Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
Are we winning the fight to flatten the curve? Dr. Frank B. George takes us inside the numbers as experts warn reopening too soon could be catastrophic.
Ready to roll the dice. We're getting our first look at how one of Detroit's casinos plans to safely reopen. So how's blackjack really going to work once they get the go-ahead?
A new crisis emerging for Michigan schools, which has nothing to do with distance learning. A massive budget shortfall could mean as much as a 25% cut in the classroom.
But we want to begin with breaking news in the UAW corruption scandal. We just learned former union president Gary Jones will be arraigned on charges Thursday via video. Jones faces charges of embezzlement, racketeering, and tax charges. We're continuing to gather new information on this story, and we'll update you as that information comes in.
Our other top stories, we hit the 5 o'clock hour. Michigan schools facing deep cuts in state funding. That dire assessment in the global pandemic could turn into a harsh reality come next school year.
Business editor Rod Maloney has a look at the numbers and shows us why the timing of the state's reopening has such a big impact.
Conceptually, we know that there isn't money coming in. But if you're looking for a bellwether, look no farther than your local elementary school, because they have to have funding in place months in advance. And as we look toward next school year, it's not just looking bad, it's looking bleak. The state of Michigan provides something on the order of $8,000 per pupil per year funding. Right now, best case, it would drop to $7,200. Worst case, it would drop to $5,600. These frightening numbers come from Senate K-12 Appropriations Budget Committee Chairman Wayne Schmidt of Traverse City.
We're looking at somewhere, estimates as high as $6 to $8 billion short over the next year to 18 months.
We contacted the governor's budget office, and Director Chris Kolb told Local 4, quote, "We need greater flexibility in existing federal funding that will allow us to use those dollars to replace lost revenue. Without added flexibility or new funding from the federal government that provides direct aid to help states address revenue shortfalls, we will have to take a hard look at everything in the budget, including education and other key priorities," end quote. Schmidt says Michigan can't count on the feds.
Our hospitals are ready for any surge, any second wave, if you will. They're prepared. Now, what we need to do is get businesses back to work. Of course, in a safe and minimal risk fashion.
Now, what you're probably wondering is what comes next. How do we avoid this? Well, on Friday, there's going to be an unbelievably bureaucratic thing called the estimating conference, the budget estimating conference, which is where the bean counters get together and look at what we've got for revenue coming in and how they can make budgets. And both sides, the legislature and the governor's office, is saying that's vitally important to try and figure out where it is that we're going from here. But the bottom line is expectations are very low. Back to you.
Yeah. All right, Rod, keep us posted. We appreciate it.
Well, today, a highly anticipated hearing in the U.S. Senate that few actually attended in person because of coronavirus fears. But 3 of the nation's top health experts and the committee chair all appeared from home quarantine via teleconference. The subject, getting kids back to school and adults back to work safely. Alice Barr in Washington, as concerns about health versus welfare led to a few tense moments, Alice.
Devin, the nation's leading medical experts gave their frank assessments today of where the coronavirus crisis stands, with Dr. Anthony Fauci warning a rush to reopen could set back not just the public health battle, but also delay an economic recovery.
Senators, we've been advised, may remove their masks.
Top health official Dr. Anthony Fauci warning today of serious consequences if states skip over federal guidelines and reopen too quickly.
My concern is that we will start to see little spikes that might turn into outbreaks.
The Senate hearing itself a mirror of the country, with the chairman and witnesses all speaking by video conference after exposure to someone with coronavirus. The focus, how to safely reopen businesses and schools. Dr. Fauci calling it a bridge too far to think there will be treatments or a vaccine in time for school this fall. But noting if communities prepare with testing and contact tracing, they can limit how bad the rebound in new cases will be.
I would hope by that point in time, in the fall, that we have more than enough to respond adequately. But if we don't, there will be problems.
It's the first time members of Congress have been able to directly question officials, including the head of the CDC and FDA, away from President Trump. Senators in both parties contradicting the president's message that the nation's testing program is a success.
And that what our country has done so far on testing is impressive, but not nearly enough.
The Trump administration's testing czar insisting the U.S. is on track and will be able to run 40 to 50 million tests a month by September if needed. In one tense exchange, Senator Rand Paul argued kids should go back to school this fall, pointing to low death rates among children.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision.
I have never made myself out to be the end all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
He also said the overall U.S. death rate is likely higher than reported, while expressing cautious optimism about progress toward a vaccine.
House Democrats unveiling a new proposal today for the next round of emergency aid, including money for state and local governments and more direct payments to Americans. They hope to vote on it this Friday, though Senate Republicans are unlikely to sign off. In Washington, Alice Barr, Local 4.
To help states avoid that rush to reopen, the government previously set forth several metrics for them to meet.
Now, many of the states have surged ahead without meeting those metrics. Dr. Frank McGeorge here to walk us through where Michigan stands right now on this. Frank?
Yeah, Kim and Devin, the White House and CDC published guidelines for reopening America that included a number of elements. Two of the critical ones being, first, a downward trajectory of documented cases within a 14-day period, or downward trajectory of positive tests as a % of total tests within a 14-day period. Here's what that all means.
When you look at the graph of daily new cases, there are clearly several peaks and valleys occurring about every 7 days since our highest number of new cases on April 3rd. These bumps are the result of reduced testing on the weekends and delays in data reporting. The problem is that this jagged pattern is hard to interpret if you're trying to look for a consistent downward trend in new cases. That's why we look at something called a 7-day moving average. It charts a point that represents the average number of new cases in the preceding 7 days, and it smooths out the graph, making trends much easier to spot. When you overlay a 7-day moving average on this graph, you can see that since about May 3rd, new cases have generally been on a downward path, and we may be near the 14-day period of decreasing new cases. So how are we doing when it comes to positive tests as a % of total tests, and why is this number important to see falling? Now, this graph is really busy. The red and green bars represent the number of tests done on a given day, with the red area at the bottom showing the number that were positive. Importantly, you can see that over time, we are consistently doing many more tests in the state. The graph with individual dots shows % of tests that were positive on any given day. When it goes down consistently, that means even though we are doing more tests every day, we aren't finding more cases. Also a good sign.
Now, my personal experience seeing patients in the ER over the past many weeks is that at least in Detroit, there has been a very consistent decrease in the number of new diagnoses of COVID-19. So my experience does match the state's data. Back to you.
Okay, Doc. Congresswoman Debbie Dingell announces Metro Detroit hospitals received millions in federal funds via the CARES Act.
Yes, 6 hospitals received a total of $159 million in coronavirus funding. The hospitals are Michigan Medicine's Women's Hospital, Beaumont Dearborn, Henry Ford Wyandotte, Beaumont Taylor, and Beaumont Trenton.
Some sad news to report. A former state lawmaker has died from coronavirus. Morris Hood III passed away Monday after being on a ventilator in the hospital since last month. The Detroit Democrat served in the state house from 2003 to 2008. He then served in the state Senate from 2011 to 2018. More recently, he worked for Wayne County in government relations. Morris Hood III was 54 years old.
Never-failingly deeply kind man. Tonight, we are getting our first look at how one of Detroit's 3 casinos will look when it reopens.
MGM Resorts put out a 19-page guide covering everything from casino operations to room keys. Let's bring in Priya Mann. She's live at MGM Grand tonight. Priya, blackjack and craps tables are normally pretty crowded. I don't know how they're going to keep people 6 feet apart.
Yeah, Kim, get ready for plexiglass barriers at the tables and employees wearing face shields. Things on the casino floor are going to look a lot different. Now, the city, of course, losing hundreds of thousands of dollars every day with the closure of the casinos. When they reopen depends on the governor. We did ask our Dr. Frank McGeorge what his thoughts were on MGM's plans to reopen.
It is possible to open safely, but there's a lot of things that go into it, especially with regard to casinos, because you're potentially talking about older people, intoxicated people. It is possible, though.
When it can reopen, the casino floor at MGM will look very different. Every other slot machine will be placed out of service. In areas where machines are closer than 6 feet, the chairs will be removed. The number of players allowed per table will also be reduced, and plexiglass barriers will be set up at tables where social distancing isn't possible.
Keep in mind, you're talking by definition a lot of close contact and a lot of high-touch surfaces. So somebody at a craps table rolling a pair of dice, they're going to be surrounded by other people. They're touching those dice. They have to make sure that there's a way to clean everything in between contacts.
Employees will wear masks. Some will wear face shields. Free masks will be available for guests. Every worker will have their temperature taken before they can enter the property, and guests will be asked about their current symptoms and recent exposure to COVID-19. MGM says its team of scientific and medical experts developed the new protocols after months of research.
One of the important considerations when considering reopening is how essential the service is, and I would not consider casinos an essential service. So I think that I would delay casino openings until we had a high level of confidence that we were not only able to protect customers, but the employees and everyone else around them.
You know, I think there's some little things that we take for granted. You know, guests will be encouraged to wear masks and free masks will be available, but in an effort to reduce the amount of time that they pull their masks down on the casino floor, they're going to be asked to limit their drink orders and refrain from eating on the casino floor. Just a few of the many changes to expect when casinos finally reopen. Again, that decision rests with the governor. Reporting live from MGM Grand, I'm Priya Mann, Local 4.
Okay, thanks a lot, Priya. Well, the Blue Angels roar through Metro Detroit in a tribute to frontline workers.
You could hear them all over. Listen in. Spectacular sight. Here's video from Sky 4 showing the Blue Angels flying by the Ambassador Bridge and through downtown this morning. Blue Angels then flipped to Macomb County before passing through the city again before heading to Chicago and Indianapolis for flyovers there. I didn't get a chance. I couldn't see them from where I was, but I sure could hear them.
Yeah, I heard them over my house too. It gave me a little chills, you know.
It was awesome.
It's really what we needed today. Well, we are off and running on a sunny Tuesday afternoon. Here's Ben.
Yeah, those Blue Angels look so much better when the sun is out. It did do some work for us this afternoon. Temperatures managed to get near 60, but we'll do much better in the 7-day forecast after the freeze warnings tonight. More on that next.
We know for many of you, the bills, unfortunately, are piling up. So who's offering help? What local companies are doing to help you during this financial crisis? Coming up in my Help Me Hank report.
One woman is battling two major bouts with their health. Hear her dramatic story coming up.